In New York, Staten Island has been one of the hardest hit places by the opioid epidemic, demonstrated by the sharp rise in opioid-related overdose deaths over the last decade. On the ground, dozens of health organizations are working around the clock to combat the public health crisis. Now, one of the groups doing the critical work is partnering with MIT to see how data and technology can help determine what is working when it comes to fighting opioid addiction and what is not. Joining us now to talk about this unique collaboration is Anna Quadgrass, Director of Health Systems Innovation at MIT Sloan School of Management, and Ashley Blauvelt, Managing Director of Strategic Initiatives at Staten Island PPS. Ladies, welcome to the program.
Thank you. Thank you.
So first, I want to start with you and just sort of ask, so people know, what is Staten Island PPS? What is your organization? What is it that you're doing?
So the Staten Island Performing Provider System, or Staten Island PPS, was formed under the Medicaid Redesign Program in New York State. And we're a network of social service, medical, and behavioral health providers that work together and collaborate on different programs and practices using evidence-based standards, patient engagement techniques to improve healthcare conditions and chronic health conditions across the board. So related to primary care, asthma, diabetes, and specifically today, behavioral health and opioids.
All right, and so then how does MIT then get connected with this organization, and what is it that you're possibly bringing to the table?
So MIT Sloan got interested in looking at how to use health analytics, not just on healthcare data, but also on social data. So we've been looking for collaborators who have data and who are similarly inclined. And so we found the Staten Island PPS through various relationships that we have. And we started talking with them about what is it that they're doing. Now, Ashley did not talk about their data yet, but what they have done is put together a very unique data set of not just medical data, EHR data, but also, as she was talking about with the social service partners, some of the social data around emergency medical services, around the criminal justice system, and other social agencies on Staten Island. So you have a much richer data set about the people that they serve, which allows us to work with them to create new kinds of analytic capabilities and test them in the field to help with understanding which interventions seem to work, but beyond that, how they work, why they work, and perhaps how they could work better.
So I think that's one of the places, and that's an excellent point to make, but one of the places where I think people might be a little bit confused, because data often seems so cold and distant and inhuman, and what we've seen with the opioid crisis is so personal, it's so emotional, and so it's so difficult for people to deal with. So how is it that you're able to take that she's able to take the data that you guys have collected and then be able to determine, at least from their standpoint, what the data is showing that's working, and then you're able to put that to actual use?
Right. So like Anna mentioned before, we take medical, social data. We have a warehouse, state-of-the-art data analytics platform that combines a number of data sources. We're able to push this out, looking at hot-spotting areas of where high overdoses are occurring, areas where the highest number of 911 calls are occurring, also looking at people's substance use disorder history and other medical history. Putting that together and, in a way to impact people would be to develop a predictive analytics algorithm that could help us prevent or know who would be at risk of having a subsequent or even a first overdose.
Wow.
Yes, so we're hoping to go from reactive to predictive using the data sources that we have and MIT's research and analytic capabilities and rigor in that field to help us develop some analytics, test them in the field.
But even with this data that you would have, and to be able to put together a predictive, method or something that could tell you at least who would be most at risk for an overdose, does the human factor still factor into this? Because, do you take that and do you tell the patient that they're at a higher risk, or because how much of it is still going to be that person struggling with their own inner demons and, of course, the effect of the drugs?
So another point is getting at the causes and not the consequences. And so another point of research that we hope MIT can help us with is looking at the root causes of addiction, which is really the underlying issue here when you talk about opioids and overdoses. That could be adverse childhood experiences, that could be other social factors that happen early on in a person's life. And so we want to try to understand more of those issues and also work upstream on also impacting those as well.
Wow. So then this sounds like something that could be incredibly useful for so many other communities across the country.
Absolutely.
But I'm wondering, since this is still very much in its beginning stages, how much time do you expect that this needs to germinate on Staten Island before you can begin to move out into other communities?
Well, we don't know exactly how long this will take. It is research. It is new. What we are doing is working very closely with our collaborators on the ground. So as we are learning, we're learning together. And the PPS is amazing at testing out, trying out new ideas, and gathering data about it. So I expect we have a fairly rapid turnaround time as quickly as we can make it. What we also, as you mentioned, it's scalable. If that, for other places, what we're looking to be able to do is to really understand what's going on so we can adapt it and make it sustainable and help scale it in other communities that also may have data, and that will actually speed things up further. The more data you have, the more understanding on the ground you have, the better you can put that together and learn and adapt and try new innovations.
We are one of the only organizations of our type that has already implemented an integrated system of care across multiple domains, including health. We work with criminal justice partners, institutes of higher education, and local government across the board using data and analytics to create targeted population health initiatives. And we've already seen a 60% reduction in preventable hospital visits for people with behavioral health issues. We've seen a 16% reduction in overdose deaths in Staten Island in the past 2 consecutive years. And we've also increased threefold the number of people that have access to substance use disorder treatment on Staten Island already.
All right, well, we'll definitely love to have both of you ladies back to give us an update on progress in some time to let us know if you like the data points have changed or what it is that you've learned. But thank you so much for at least being bold enough to try something this new and unique to address a problem that so many communities are struggling with.
Absolutely.
Thank you so much.